Thank you, Chair. Dr. Tabak, during the time you were deputy director, the 7 hearings we had with Dr. Collins, who was the director at the time, I think every single time he talked about the importance of NIH bringing hope to millions. I want to talk a little bit about the proposed ending of funding for the Undiagnosed Disease Network. We have one of those in St. Louis. Chair Murray has one in Seattle. I had somebody reach out to me a couple of weeks ago, Mitchell Herndon from Afton, Missouri. She was concerned because her son Mitchell, who had suffered from a series of health issues that doctors couldn't diagnose, had benefited from one of the centers. In fact, by late high school, he was in a wheelchair. His hearing was gone. His eyesight was gone. They were losing hope. But after they sought treatment at the Undiagnosed Disease Network in St. Louis, they found a neurological condition so rare that it didn't even have a name. In fact, Mitchell lost his battle. The condition he had is now carries his name, the Mitchell syndrome. But Michelle and her family were comforted by the fact that they finally knew what this long struggle had been about. This year's budget cuts the Undiagnosed Disease Network and closes all 12 of its clinical sites. She was concerned about that. I am too. I think there's some discussion, well, they may graduate in some way to where they continue to exist. I think it'd be a problem to walk away from that. Not everybody can come to NIH and Bethesda. And if you don't have a site within some reasonable distance of where you are, you're unlikely to get this service. Do you want to talk about why that decision was made to stop funding these 12 sites?
We certainly agree that the diagnostic services provided by the Undiagnosed Disease Network are extremely valuable to patients and to their families. The challenge that we face is there does come a point where diagnoses become part of standard care versus a research question. But finding that right balance is something that we continue to work through. All the cases that are enrolled presently will continue to undergo comprehensive evaluation. We will establish a data management and coordinating center to draw upon the experience of all of the centers that are participating in this program. But really, we'd like to work with you going forward to come up perhaps with a better solution in the mid and long term.
Good. Well, let's continue to work on that. I mean, you can't have standard care if you are still discovering things that need to be looked at as an option. Mitchell syndrome is Mitchell syndrome only because he was the first and maybe the only diagnosed person so far that ever had that. And that's going to fall outside a standard care definition, I think. So let's continue to work on that.